serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
I see them at the same time I see my other ones.
And hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. For this Tuesday edition, we're really going to talk about a lot on the program, a lot about medical cannabis, which, you know, is timely. It's in the news all the time, and we're going to kind of release the stigma a little bit on some of the ramifications with medical cannabis here in South Florida. So without further ado, welcome back to the program. I think for like the fourth time. Last time he was on, we had like 3,000 views, so we're so happy to have him back on the program. Dr. John Baker, welcome back, Dr. Baker. How are you doing this evening?
I'm good. How are you?
Thank you, and
good.
Thank you for coming along. I always say on this adventure of health,
yes,
because we're always learning the greatest and latest in health news. And you're an orthopedic surgeon and sports medicine specialist. That's your specialty. But a few years ago, well, maybe not even a few years ago, maybe a year ago, and you can correct me if I'm wrong, you got into the process of the medical cannabis card, or as you might say, medical marijuana card, because you wanted to help out people get off painkillers.
Off that, and I see a lot of people with back pain, chronic pain, different things like that. Some cancer patients I've seen.
Oh yeah.
And just try to get them. A lot of them are taking narcotics and pain meds, and one of the things that we found with this is we've had a lot of those patients get off of them, and a lot of are depressed at the same time because they're hurting. So they were on antidepressants, they're on a lot of different things like that. Not that I'm trying to get them off of all that, because that's kind of what the other doctors can do for that. But from the standpoint of the CCAM, a lot of them have done that.
And the CCAM, tell us what that is.
Okay, so CCAM is my company, and it's Compassionate Care and Alternative Medicine. That's what we named it. It's on, we have it on Facebook. We have it. We're also, out of both my offices in Del Rio and Boca, and that's the name of the company. And for short, we call it CCAM.
And it's a clinic inside your actual office.
Correct.
Okay, and your office is obviously an orthopedic and sports medicine office.
Yes, and I do some workman's comp, and I also do some auto cases too. And that's where we were seeing, the big problem with Florida was we're number one for narcotic use, and we had a lot of pill mills in Florida for a long time, and then they started coming down on those. So what we see is a lot of these people have got on these meds, and it's hard to come off these meds. And the ones I've been taking care of, we'll see them after they may have had an accident, so they'll come back and see me for their second accident because I was their doctor in the first one, or they'll get referred to me from a chiro or something. But they're on pain meds, and these pain meds aren't good. We don't want to be taking them. There's too many side effects for them, and just so people can function to get out of bed in the morning. A lot of times they're popping pills, and you don't want to be taking them. But the biggest problem is that you're driving on them. And like we say when we have surgery, if we put a patient on pain meds, for example, Percocet or whatever, we really don't want them driving and doing that on those meds. So we usually want them to be down for a little while so they can heal.
That's for sure. And I actually had broken ribs a few years ago, and I had some Percocet. And even a big guy like myself, I couldn't even drive on them. Those are some some powerful medicine.
Yes.
Right there. And I wanted to have you on again, not only talk about, orthopedics and sports medicine, but medical cannabis, because there's a lot of stigma about it. There's a lot of people just don't know. It's like one of those things. And let's start right here. What is low THC cannabis and medical cannabis, and what kind of forms are available if someone was to come see you and qualify for this card?
So the process is pretty simple. It's you got to come in. We go through a medical history for you. We write down what the problems you're having are. Do you have Crohn's disease? Do you have irritable bowel disease? Do you have sleep apnea? Chronic pain? Those are the things that we've been writing for, and those are that's what they do. So they would come in for a visit. We do a consult for them. If they qualify, then what we would do is fill out their paperwork. We show them how to go online and give them like a form that they go online, they sign up with the state. Once they've done that, they'll get a card shipped to them. Once they get their card, then they will go to the pharmacy the first time. Sometimes more than once. It just depends on what we're trying to get them on and what kind of dosing they're doing. And then usually what they'll do is put them on a different strand during the day so they can function, but there still takes that edge off. And then at night, they'll usually give them a different kind of strand, so maybe a little bit stronger, because a lot of these people can't sleep. They can't sleep at night, or they're in pain, they're popping pills, or coming home and having a couple shots so they can go to sleep on top of their pills and whatever. And you just don't want that, doing that. So at the end of the day, the cannabis is helpful for that. The low THC it's not like the stuff you're going to get on the streets. It's a medical grade, and you can get 0.3% in your oils. So a lot of these oils, you'll see people selling the oils where they can do a sublingual oil, or they can use creams, or some people are using them for massaging with the cannabis oils, and they have up to 0.3%. The THC that you get is different strands and different levels, and it'd be a long time to go through all that to tell you like what it is, but there's different ones. But in the pamphlet, if they come inside this pamphlet we've made up for them, goes over different strands and what qualifies and doesn't qualify.
Yeah, show the camera if you could. There you go.
And we have these pamphlets in my office, and we hand them out, as they come in. If they have any questions, they can come on in. They read the pamphlet. If they want to make a consult, they can make a consult with me, and then we would see them for that consult, and then get them set up for it.
That's very helpful. Actually, the last time I had you on, I used that as my research, that pamphlet. And if you want to find out, where Dr. Baker's offices are located, where to find him, we're actually streaming right now on Facebook, and his Facebook page is Compassionate Care and Alternative Medicine. Just put at CCAM so it's the at and CCAM Medical, and you'll find it, or just search it in the Facebook search bar there. Dr. Baker's office is located at 9033 Glades Road, Suite B, Boca Raton, and 190 Congress Park Drive, Suite 160 in Delray Beach, and I'll give that out again. And Dr. Baker, I didn't jot down the number. What's the number at your office?
For my office, my regular office number is 561-330-4358. And the cannabis number for the CCAM clinic is 561-706-9189. 706-9189.
Okay, we'll give that out again a few times before we break for the evening. I wanted to ask you, that was, great info there, but I think it's important to let everyone know, you're the doctor here. You're actually controlling the amount of dose, milligrams or whatever is that you actually decide on the dosage, correct?
We work with the pharmacy on that, and a lot of times what will happen is, that's what I'm saying, sometimes they have to go to the pharmacy more than once, because the first time they want to sign up with the pharmacy, they want to go over all the different things with them. They tell them what they got going on, and they make recommendations on what would be the best for them during the daytime and what would be the best for them at night. They usually put them on two different strands, and you can do it two ways. You can do it sublingual, okay, and this is the medical marijuana. You do it sublingual, or you can vape it. It's like a little vaping pen, and they give you that, and you just load it up, and you take a couple of vapes. It's really not smoking, it's vaping, and so that's kind of what they do with that. So much more healthier for you also. You're not bringing all that stuff all the way into your lung with the other stuff that's in the pot out on the street, the marijuana out on the street and stuff. So this is a little bit more healthy for you, and it's medical grade.
Okay. And that's the medical cannabis.
Yes.
And the low THC cannabis is not psychoactive at all, and it's very it's more for like the nerves or body feeling.
Yeah, and it can help
for
with
pain.
Yeah, it can help with pain. It can help with spasms. It helps people sleep. And so, and obviously we need sleep. I mean, a lot of us don't sleep very much,
Yeah,
I mean, just the fast-paced life that we have, but you got to get some sleep at night, and a lot of people can't sleep. They're up rolling around all night. So, the body needs time to heal and rest, and overnight, that's kind of what that would do for you.
Yeah, that's most important. I mean, to get a good rest, at least 7 to 8 hours, I think for an adult is what's recommended. If you're not getting that and you need help getting to sleep, I mean, it's definitely time to talk to a doctor. And now, do patients have to be referred to you, or can they just make an appointment or walk in and kind of just hey, say I'm here, I'd like to learn a little bit more?
Sure, they could come. They could walk in. We could take a pamphlet and we could set them up an appointment if they want to do that. Also, they can go on the Facebook page, and then that number I gave you is a cell phone that's carried by my practice. So if they want to call in to that number, that number will get them a chance to be set up for an appointment, and then we would give them a date.
That's great to know. And that number is 561 area code right here in South Florida, 706-9189, 706-9189. And that'll get you set up at Dr. Baker's offices in Boca Raton or Delray Beach. You mentioned something that I found extremely interesting, because I've been following this pill mill and this whole pill story since the start. And I used to be a chef in this area, and I've lost a lot of friends. I'll tell you, a lot of cooks. I think I mentioned that last time, that I had people I cooked with. I mean, it's like 5. It's insane. And I'm originally from Jupiter, but I've lived last 10 years in Delray and Boynton Beach, and this has been the epicenter of this whole pill issue. Was right there.
Right.
And to take the time to get off of painkiller, or help a family or friend maybe get off if they're addicted to them. If they need something to get through the day for pain, sleep apnea, or muscle spasms, or whatever falls under that criteria that can be treated with the CCAM clinic, do it. Get them to see Dr. Baker. Find out the information, educate yourself, because when someone starts taking opiates that are man-made, and you can kind of piggyback on this, it messes with the brain receptors in your head, and you're never going to be the same. And over time, those brain receptors, they crave that opiate, and they want more, and it's never enough. I've had friends who quit for 6 months, and then overdosed, then did it once, and then overdosed because they had to do so much of a higher level to get to that same point where they used to be 6 months ago.
Right.
And they overdosed, and unfortunately they passed away. And this is a true story. I mean, this is not something I'm kidding about, but to have an opportunity to, maybe vape a few times during the day, or take something, oil that you can put on your tongue that's not even psychoactive, and you can get through the day, is just an amazing opportunity, I think. And does opiates do that to the brain receptors?
Yeah, well, the receptors get used to wanting that there.
Yeah.
And it does. Sometimes your doses get higher and higher and higher, and what you'll see is they have to take, more and more pain pills. And then, not only that, just a lot of them are on Xanax or anxiety meds or whatever, and people are dying on that stuff, and they're mixing them.
Dr. Baker, hold that thought. We're going to take a quick commercial break on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. Today we're here with Dr. John Baker. He's an orthopedic surgeon and sports medicine specialist. Those are his medical specialties. He's also a local doctor helping to treat pain, sleep apnea, and other ailments with medical cannabis. At his offices, they are called the Compassionate Care Alternative Medicine Clinics. They're right in his offices at 9033 Glades Road, Suite B in Boca Raton, and 190 Congress Park Drive, Suite 160 in Delray Beach. Or for more information, you can call 706-9189 with the 561 area code, 706-9189. Dr. Baker, last time we had you on, you told us a great story about, obviously, cancer and cannabis have been kind of intertwined for a little while now because it's been proven to help people with the nausea and other ailments associated with certain types of cancer. So you were able to, someone requested to their primary care doctor if they could come talk to you about when they had first found out that you could help out with maybe a medical marijuana card. And I'll let you tell the story. You helped them out, and you actually consulted with their doctor, and everything worked out good, and they're happy patient.
Yes, she had breast cancer, and was sent to me by one of her friends that heard about us. So she came into the office and wanted to see if she qualified. Well, obviously that's one of the qualifications for it. She wanted to go on it because she was having a lot of nausea, vomiting. She's also still taking her chemotherapy. So when I told her, I said, well, let's talk to your oncologist and let me know. And he had no problem with that. So we kind of consulted back, and she came back to see me. And at that point, so she's like, I don't have any issue with you taking that along with that. And she's doing really well.
She's doing very well. Great to hear, actually.
Yeah, so she's able to take her chemo, and she not have to take a lot of nausea, vomiting medicine, and she's feeling better. Her pain's better, and she's happy. So
I got to ask you another question. A lot of women ask me outside of this show. They always refer to this show when I have you on, and they always say, "Can I get the medical card for headaches or migraines?" Has that been figured out yet or not?
I think it's coming. It's even when we write for pain, it's still kind of, you have to really put it on there, like what their diagnosis is for chronic pain, because it's really not like, if you look at the list, they're getting more and more on there, like sleep apnea, IBS, multiple things. I think MS is on there now too. There's a bunch of them that are on there, and so there's like a list of what the state of Florida has allowed so far. But a lot of us are writing for those areas, and most of the guys that have signed up for it are writing for most of that area, and some of them is with the chronic pain.
Yeah, and I was thinking of the list. I mean, other than Crohn's disease, I'd be able to check off one after another. So if there's something you or a family member, have in terms of pain or ailments, it may be a great resource for you to, talk to Dr. Baker and his staff. Like I said, we're on Facebook, and Dr. Baker's now on Facebook too, at CCAM Medical. There's some info there as well. I want to talk also about potentially referring physicians. So one thing South Florida has, we have great physicians. I'm so lucky to do this show and have so many great physicians like yourself on. And primary care doctors. Now, if a doctor comes across this program and wants to find out more, can you consult with them or talk with them a little bit? I guess doctors do a consult, or how does that work?
Yeah, so I'm usually some of the doctors out there still have a stigma of writing, and and I think it's going to we're going to see more and more doctors sign up for it. But the ones that have signed up for it, like what I'll get a lot of my referrals from is like the patient will ask them for it, and they don't write for it. But then, a lot of times they'll say, oh, well, I know Dr. Baker. He's an ortho. Go see him. He's over here. He writes for it if you qualify. And so there's still some stigma out there. And the other problem we had too was the pharmacies. We only had a couple pharmacies. Now we got 4 now. So the pharmacies are starting to get supply to where, if more and more scripts are written, they're going to be able to get them faster. And they fixed the problem in Tallahassee. They've moved it over to Tampa now, to where they've got people working on this, so that it's not taking 3 months or 2 months for them to get their card. So that's been good too. That was the biggest problem we had in the beginning. Was we only had very few people up in Tallahassee were working on this, and then they didn't realize how many people were going to be getting on it, and so they just were overwhelmed. And so a lot of patients weren't able to get it for a while, and that was the biggest problem we had.
Yeah, it takes time to figure out. It's a new program. I mean, I think Florida's done a great job with it from what I've heard as well. And you said there's now 4 pharmacies. I was familiar with the one in Lake Worth and Boynton, but there's a couple more you know about?
Yeah, there's one it's like North Miami, and there's another one. I'm just not sure what that was.
Stewart area, I heard about.
I think they're trying to put one up in Stewart too.
Yeah. Okay.
The person that could help the most, if you any questions on this, Emily is my medical assistant in my office. Also runs my office and is a wonderful person. But she does the CCAM. And we carry that phone with us, and then what they'll do is they'll make an appointment with you. And if you have questions, you can call that phone, and they can try to answer some of those questions for you. Or like I said, if you want to come by my office and get a pamphlet and just stop in and read about it, if it's something you want to do, we have no problem with you doing that too. And if you do make an appointment, it's about a 30, 45-minute appointment just for the consult, mainly because you have to fill out some paperwork, and then we have to go over everything with you and how you would do that to get your card and do what you need to do, so you can go on and do it yourself.
And that number's 706-9189, and they can just talk to your staff. And I got to give a shout out to Emily. She's been great. She helped me get you back on the show.
Yep.
So thank you, Emily. If you're listening, I do appreciate it as well. And yeah, doctors, residents of South Florida, give Dr. Baker's office a call, and like you said, come by, get the pamphlet, talk to your friends and family. Anything you can do to get anyone off of painkillers that they may be addicted to, because that's when it becomes a problem, when it takes over the quality of life. And you mentioned Xanax before as well. If you can get off of something, it's probably a good idea to do it, because you become dependent on it, and that's when, like we said, it becomes a problem. And we don't want that to happen. We all want to live have a great quality of life. We're here in South Florida.
Right.
We're here in the fun and the sun, and we got to enjoy it. Tell us a little bit more about Allegiance Orthopedics. That's your sports medicine office as well. What are some of the most common ailments you treat? What do you specialize in?
So I do a lot of shoulders and a lot of knees. And I do the Mako total knee out of West Boca. So I've done some totals now. And so we were doing the uni knee. Now we're doing the total knee. So we're doing that now. But my big area is sports medicine, and a lot of shoulders and a lot of knees. And I do stem cell and platelet-rich plasma at the same time. So you can there's different ways of doing that, and we've kind of been changing things up a little bit with the platelet-rich plasma. But I've been getting good results with that on my sports cases and things because we are out here playing a lot of golf and tennis and a lot of things. They'll come see you for that, and we've been using it on that for those areas. And a lot of people that have bad arthritis that just don't want a total joint yet. We've been trying it on them, and we're getting good results on that. So it doesn't work for everybody, but it's something to try. My prices are very, very competitive out there with the Boca area. If the stem cells would be something that you'd have to have shipped in overnight, so you have to make an appointment for that. The platelet-rich plasma I do in both my clinics, in Delray and in Boca.
Okay, and that's done right in the office.
We do it right in the office.
Wow, and I heard that can be, a pretty quick trip as well. I mean, if everything's all set up, paperwork's filled out, I mean, you can almost be in and out.
Right.
They have to maybe sit for a few minutes here and there, 15 minutes or something.
That's about it. And then basically what we do is we bring you, we get your paperwork, we bring you back, we get your blood drawn, so that we can spin that blood down, because it takes about 20 minutes to 30 minutes for that to spin down. That's really the longest wait. And then once we spin that down, we give you back your what's called platelet-rich plasma, and we get rid of the bad cells that aren't going to really help you. And that plasma has been known to help with healing processes, and it's been around for a while. We were using it when I was in the military. I was a commander in the Navy during the war, so we were using it at that time period on a lot of our guys that we would do a repair on, and we would give them back in the hospital what we call APC, which is kind of the same platelet-rich plasma.
Well, thank you for your service. I should have started with that on September 11th, but do appreciate it.
Yeah.
Veteran U.S. Navy. We get some great guests on this program. I'm so happy about the direction we're going in. And we have less than 2 minutes, so again, I want to give out your info again. Go see Dr. Baker, whether you have pain or orthopedic injury or ailment. Again, 9033 Glades Road, Suite B, Boca Raton, and 190 Congress Park Drive, Suite 160 in Delray Beach. If you're interested in the CCAM medical cannabis, call 561-706-9189. That's 706-9189. You can talk to Emily. She's very helpful. She helped me get Dr. Baker on the show. So, don't be a stranger. Come back, but I know you will.
Yes.
You've already been on here 4 times. You may get closer to the lead. I don't know which doctor has the lead in the last 3 years I've been doing this, but you're up there. But we're so happy to have you.
Thanks, I appreciate it.
And keep it up. I mean, it's a great thing you're doing.
It's really good for them. So for the patients.
I appreciate it. And that's why we do this show. I mean, that's why I do it. We'll see you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The Heart of Delray Gallery, located in the Delray Art Complex, is one of